Hello everyone. The purpose of this demonstration today is to show you what your lab handout will be in terms of stretching and strengthening. We're going to start with stretching, and the 4 techniques that we're going to do is going to be your manual static, your hold relax, your agonist contract, and your self stretch. So I want to really take you through those manual techniques. The self stretch you can do on your own, and I will take you through that in the lecture component when I'm online with you. But for now, we have Matthew that's going to be our patient today. Hi, Matthew.
Hey.
I'm going to be your physical therapist assistant today, and we're going to be doing some stretches to your hip. Is that okay?
Yeah.
With you? Good. And they know this is our competency way of speaking to our patients. So the first muscle I'd like to start with, it's on page 4 that starts your stretching. It's going to be iliopsoas. And we know iliopsoas, the way we take the measurement is at the hip. Hip extension, if it's short, a shortened muscle length is going to not get to 0 degrees of extension. So you'll have that -10, -20 look to the patient in the hip extension action. So I'm going to have Matthew get up on the table, and we're going to take him through the Thomas test position. So I'm going to show him, he's never done this before, and as we've done in muscle length, we show our patient. So Matthew, basically what you're going to do is you're going to put your buttocks up on the table as best you can, kind of slightly sit, hook under your leg, and I want to have you come back and just let that right leg just fall as gravity takes it, and just relax, okay? So I'm going to have him do that. I'm going to have my pillow ready so that when he gets up on the table, okay, yep, he's comfortable. All right. And I'm going to control his leg now, because you're going to see if he's stabilizing correctly. So pull that leg towards you. There you go. We want the pelvis to be stable. We don't want any anterior pelvic tilt. I'm always going to check the lordosis before I begin. As you can see, if you want to come around this angle, he does have a short iliopsoas. His leg is not resting horizontally on the table. We have some angle here, and he probably is somewhere between a -5, -10 degrees, I suspect. So we know we have an indication to stretch those hip flexors. So what I'm going to do, maybe angle over here, camera. Okay. You doing okay?
Sure.
All right, tell me if you feel any pain or discomfort. So we're going to stretch the muscles on the front of your hip, okay? So I'm going to control the leg so the patient can relax, and I have his leg against my hip and firmly grasp with my right hand here. Now, to stabilize even further, he's doing a great job here. He has no lordosis, but I'm going to place my other hand, my stabilizing hand, on the left. Can you get the left? You see the left? I'm going to have my stabilizing hand at his ASIS. I'm going to slowly bring him down till he feels tightness. Do you feel tightness there?
No.
Not yet. Now, if you look at my right hand, I'm pushing down. So come over to my right hand. Can you see it? I'm pushing down towards the floor, towards extension. Do you feel tight there, Matthew?
Little.
Okay. So now we're going to go a little bit further, and I want you to tell me that you feel a stretch. You feel it there?
A little.
Okay. So we're going to keep stretching, and I want you to count with me to 30. So we're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So for time purposes, we're just going to cut to the 30 seconds. We're going to do that 3 times. So I've just done my manual technique. I'm going to now go into the hold relax technique. Did you feel a stretch on the front of your leg there? Okay, great. Getting feedback from the patient is important. Make sure they felt the stretch where you intended it to be. So now with the hold relax technique, what I want to do is contract the iliopsoas for your 10-second isometric hold, and then go into the stretch. So the same procedure goes for going to the point of tightness. Do you feel tight there, Matthew?
Not yet.
Here? You feel
No.
tight here?
No.
Okay. We're going to back off 5 to 10 degrees. So I'm bringing him up away from extension. I'm bringing him towards flexion here, 5 to 10 degrees. And now I'm going to ask you to lift your leg towards your nose. So push into my hand towards the ceiling. and hold it. 1, 2, 3, count with me, 4, 5, 6, 7, 8, 9, 10, and relax your leg. And we're pushing into extension to stretch. Do you feel the stretch there? Yes? Okay, we're holding 1, 2, 3, 4, count with me, 5, 6, 7, 8, 9, 30. That was our hold, relax technique. Don't forget to give your patient a rest between the stretches. You want to hold their leg up so they can completely relax. Do you need a rest, Matthew?
I'm okay.
We have one more technique to go. Okay? The next and final technique is going to be your agonist contract technique. So, we know that's an isotonic contraction to the hip extensors. So the hip extensors, we're going to do extension with that isotonic contraction in between. So we're going to go to the point of tightness. You ready, Matthew?
Yeah.
All right, so we're going to the point of tightness. Do you feel tight there? Right here?
Yeah.
Okay. We're going to back off. Remember the 20 to 30 degrees. So I'm backing off so that now he could push down towards the floor into my hand. So provide resistance, but allow the patient to move. Push, 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 Matthew. Push, 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 push. And relax your leg. And we're stretching. You feel the stretch?
Yeah.
Okay, we're going 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So again, 2 to 3 times, 30-second hold. Okay? And that is your Iliopsoas 3 techniques. Okay. And we're going to get our patient up off the plinth now so you can cut if you want to.